Hey, it's Craig from Steppin Physical Therapy, and you may be watching this video because you have something called TMJ dysfunction. What that stands for is temporal mandibular joint dysfunction, and that's just a fancy word for jaw pain. Your jaw or your mandible connects into your cheekbone, and there's a joint there. A lot of times you can get clicking, popping, sharp pain. It's hard for you to open your mouth or chew hard foods. It may hurt to sleep on that side. These are common symptoms of TMJ dysfunction. The first exercise we're going to do for TMJ dysfunction is pretty simple. All you need is a pen or a popsicle stick. What you're going to do is you're going to be facing a mirror, and then with your bottom incisors, that's the first two teeth right here, the middle line, you're going to have the stick line up with that spot. Then in the mirror, you're going to be watching your jaw open and close. So I'm going to do it slowly. I'm going to open my mouth wide as I can before I feel pain or popping. That's important. So what I did is I opened my mouth as wide as I could within my pain-free range, and then I held that position for 5 seconds. If you have TMJ dysfunction, you may notice that one side of your jaw travels. So as you open, it may veer to the right, it may veer to the left. Your job is to use your jaw muscles to keep these two teeth lined up with the stick in the mirror. What I would do is do 10 to 20 of those, holding the jaw open for 5 seconds. And I would do 2 to 3 sets of that. The first stretch is called a sternocleidomastoid stretch. To start, you're gonna hold the chair with your hand, then you're gonna rotate your head away from the shoulder, and then you're gonna tilt your head backwards. Think of it as I'm putting my right ear in my right back pocket. To do the other side, hold the chair, turn the head to the opposite side, and then tilt the head back. I'm imagining I'm putting my left ear in my left back pocket. Hold that stretch for 30 seconds and do 2 to 3 of those. The next exercise we're going to do is called a chin tuck. First, you want to look forward and do a double chin. What I'm doing is I'm using the muscles in the front of my neck to retract my jaw backwards. It helps sometimes to have 2 fingers on your chin to push it along. Hold that for 5 seconds and then do that 10 to 15 times. A common mistake when you do a chin tuck is to look down. You want to make sure your head is level when you're coming straight back. So we just went over 3 exercises for TMJ dysfunction. What I would say is I would do these 2 to 3 times a day for at least a week. Give these some time to take hold and do their work. If by a week they're not getting better or your pain's actually getting worse, you may need to see a physical therapist for further evaluation.